At the height of the HIV/AIDS epidemic, and in many areas still today, there is stigma and discrimination associated with those who live with the disease. This has become a major obstacle in successfully addressing the complex needs of HIV/AIDS patients and implementing prevention programs in the United States. In 1990, the Ryan White Comprehensive AIDS Resources Emergency Act was enacted to provide federal support and resources to individuals afflicted with HIV. Today, known as the Ryan White HIV/AIDS Program, it provides financial support for healthcare services to those with HIV/AIDS without health insurance, insufficient coverage, or lacking sufficient financial revenue. Accompanying the rise in prevalence of HIV/AIDS persons, Arizona has seen an increase in enrollment in HIV-specific programs. Estimates show that about 1,300 persons with HIV/AIDS enrolled in Access will be ineligible by July 2013. With this estimated increase in primary care needs of HIV/AIDS persons, greater emphasis is being placed on establishing systematic and coherent regional needs assessments that can be merged with a statewide picture that accurately reflects the reality of unmet needs in the northern Arizona region. The goal of this study was not only to evaluate the efficacy of current services provided by Flagstaff's Ryan White program, but also elucidate how HIV is experienced in northern Arizona.
The needs assessment utilized both quantitative and qualitative data collection in a mixed methods approach. The research team consisted of 9 medical students affiliated with A.T. Still University School of Osteopathic Medicine in Arizona, located at North Country Healthcare in Flagstaff, Arizona. Through the partnership between North Country Healthcare and ATSU, data was collected under the auspices of Ryan White Program, housed by North Country Healthcare and serving eligible HIV-positive patients of Coconino, Navajo, and Apache counties. Quantitative methods consisted of a mailed survey to all current clients of the Flagstaff Ryan White program. This information was analyzed in SPSS to determine demographics, service utilization, barriers, and socioeconomic variables. Survey results were utilized to develop items of inquiry in the qualitative branch of this assessment. Qualitative methods include focus groups with clients of Ryan White program and semi-structured interviews with service providers, program coordinators, case managers, and healthcare providers. The objective of the focus groups were to identify concerns relating to the care clients received from the Ryan White program and to better define the unmet needs of a poorly understood population in rural northern Arizona. Focus group participants were assigned to a group based on geographic location and previous grouping from monthly Ryan White program meetings. Focus Group 1 was conducted at the North Country Healthcare's Flagstaff Clinic. Focus Group 2 and Focus Group 3 took place at a private residence in Show Low, Arizona. Additionally, ATSU student researchers carried out semi-structured interviews with 6 Ryan White program providers, 3 case managers affiliated with the Flagstaff Ryan White program, and 3 specialty HIV providers who treat clients served by the Flagstaff Ryan White program. Guiding questions were developed to elicit a provider perspective of Ryan White program deficiencies, in addition to common obstacles that HIV patient individuals in northern Arizona must negotiate in their quest for health. Each encounter was audio recorded and later transcribed by a professional third-party transcription service. Each primary transcript was checked and processed for errors against the recordings. Processed transcripts were then imported into in vivo qualitative data analysis software. A structural framework and coding tree were designed and utilized to identify recurrent themes that appeared during the client focus groups and provider interviews. Memos were also created to analyze the predominant sub-themes, patterns, and meanings for each node and theme. Triangulating the data used mixed methods approaches enabled for a clear assessment of whether current interventions are addressing the needs of adults being served by the Ryan White program, as well as identifying ways in which it can be improved and adapted for diverse populations of HIV survivors.
Quantitative analysis of survey-generated data included demographic information from clients enrolled in the Ryan White program in Flagstaff, Arizona. We received responses from 25 clients scattered throughout 3 large counties in northern Arizona. Basic demographic information can be found in Table 1. The research team identified significant themes that appear to be important to the participants regarding the management of their illness, including stigma, transportation, and continuity of care. These 3 in particular seem to interact with each other as those facing stigma were forced to seek fragmented and discontinuous care at distant clinics, exacerbating the impact of deficient public and personal transportation. Further, clients expressed their reliance on social support and forging familial bonds which reinforce notions of self-worth, identity, and purpose. Stigma was the most common theme presented by both providers and clients. In rural locations, however, clients reference stigma sevenfold more frequently than clients residing in the more urban setting of Flagstaff. As one Ryan White program client stated, "So I'm very careful about my pills. I get it and take off the label and put it into containers so it looks like vitamins. It's been 3 years in December and I still haven't told anyone. I was killing myself with stress. I was mentally hurting really bad because I don't want anyone to know. I was ashamed." However, among the stigma, clients also spoke of HIV as a blessing. One client said, "A good friend of mine told me one night, and I've never forgotten it after all these years. He said, 'Juan, do you know that we're blessed to have HIV? It's a gift from God.' And I said, 'I agree with you 100%. I feel very lucky. It's a gift and it made me feel blessed that it came into my life." Many clients explained that in their effort to maintain confidentiality and avoid the stigma of being labeled HIV positive, they frequently travel to distant sites for treatment. The vast geography that comprises so much of northern Arizona compounds this problem for many clients. All providers and clients describe the difficulty in managing HIV without reliable transportation through narratives revolving around prescription medication procurement, doctor visits, and even participation in Ryan White program activities. The state Medicaid program does provide free transportation to its members for provider appointments. However, clients and providers related the difficulties associated with these programs, such as coordinating the transportation days in advance. Further, funds to distribute gas cards to clients have been limited due to budgetary constraints dictated by the Ryan White Program administration. Many clients revealed instances of having to travel far to visit with a single specialist, only to be seen with a small facet of the complex medical tapestry that so many HIV patients represent. Clients also expressed concern over the ability of their physicians to adequately manage them as dynamic individuals, and sought providers with intimate knowledge of not only the CD4 count and viral load, but also how those variables interact with liver disease, cardiovascular health, or mental health. Both clients and staff felt that case managers were overstretched, which limited the amount of personal attention that some clients felt entitled to. When accessible, clients found great utility in case management for a number of reasons, mostly having to do with their case manager's ability to connect them to limited resources such as food, boxes, or medical assistance. Additionally, some clients valued the personalization that was attained here as opposed to Ryan White programs in larger cities like Phoenix. Both clients and staff perceived a disconnect between the state administration of the Ryan White program and the local Ryan White program contractor. Both pointed to the limited funding for auxiliary programs like food boxes and gas cards, as well as misappropriations of funds. Providers expressed frustrations over the lack of communication with the state. However, even with limited funding, the Flagstaff Ryan White program has managed to meet many of the needs of their HIV-positive clients. Particularly successful have been the group meetings, which have reportedly prevented mental health deterioration, promoted adequate disease management, and buffered stigma. A criticism regarding case management included a general confusion over the role of a case manager. Among the 3 separate focus groups, support systems were spoken of as a positive contributor to their health at least 65 times, representing the most frequently discussed aspect of managing the deleterious sequela of HIV infection. Social support was attained primarily through Ryan White program organized group sessions, which provided a source of motivation and inspiration for those participating. Both clients and providers frequently referenced those group meetings as larger representations of family. As one Ryan White program case manager related, they're very family-oriented up here. Some of them don't have a lot of family, and the group has become their family. We all then become their family. So it's all about family and trust. They continued, "I have one person there, Mary, who comes to support group, and that's really all she needs. But without that, she'd be dead. She already told us, I'd be dead. I would shrivel up and just go away." Upon being questioned about the potential utility in employing a mentor support program, Clients enthusiastically approved of the idea. One client stated, "I think it would be great because when I first came, I was just lost. I was lost. I was just newly diagnosed and I was just so lost. Even after the meeting, I was lost. It took me a while, a good year of always coming to the small groups."
This study aimed to identify the needs of the HIV/AIDS population served by the Ryan White program of Flagstaff, as well as evaluate the services currently provided using a mixed methods approach. Due to the complex nature of the disease itself, coupled with the dynamics relative to living with the disease, a mixed method design may have avoided the limitations that strictly quantitative measures inherently carry. This gives the research a more reflexive feel as it can respond to unforeseen pressures of complex environment. Thus, using a mixed methods approach to conduct a needs assessment study can greatly enhance our understanding of client utilization and satisfaction of services provided by the Ryan White program. The quantitative data gathered from survey analysis offered several insights to the Ryan White program from the client's perspective. The monthly income of survey respondents ranged considerably. However, the mean annual income of $14,220 placed clients just above the 2013 federal poverty level for a household size of 2, which is $15,510 per year. Furthermore, respondents reported experiencing high costs of medication and insurance coverage difficulties. Given the low income of the survey population and the socioeconomic barriers of living in rural and frontier locations, it is likely clients have difficulty obtaining basic necessities like food, housing, and transportation. Furthermore, these barriers introduce further complexity with patient adherence to their HIV regimens, prescription payments, coordinating medical appointments, and staying connected with Ryan White program personnel. Without proper financial assistance for medications, HIV-positive client compliance will likely decrease and potentially lead to poor management of the disease, greater transmission risk, and further complications from viral mutation. Despite one of the chief objectives of the survey being to gain insight into Ryan White program programming, the results were significantly limited by inadequacies in the survey design. However, clients did not seem to understand how to rate all items in the table detailing the various Ryan White program services, which led to inadequate data. This data was deemed to be not suited for analysis. Furthermore, clients' responses suggested confusion regarding several questions, particularly a question about current risk factors. Both clients and providers expressed the deleterious effects that stigma, isolation, and worry can cumulatively have on an individual. In fact, stigma appeared to be the ubiquitous backdrop to most of the narratives that were collected at the focus groups. As one client stated, "I wasn't living a really good life before anyway. I mean, I was really doing drugs and everything, so I'm thankful that it stopped me." These findings suggest why clients so readily accepted the idea of mentor support. The need to be needed, or the renewal of self-worth, holds high currency among the chronically ill and particularly among those we interviewed. The lack of adequate transportation emerged as a significant barrier to well-being and quality of life for clients of the Ryan White program. Clients in all 3 focus groups, as well as all 6 providers interviewed, described transportation as having a negative impact on managing HIV in northern Arizona. Unfortunately, the rural setting of northern Arizona precludes the option of public transportation, forcing patients to miss appointments, leave gaps in medication regimens, and further fuel the worry and depression that frequently accompany the insidious nature of managing a chronic illness. Quantitative data revealed that the large majority of respondents were satisfied with their case managers. None were unsatisfied or dissatisfied, and 12.5% were neutral. The qualitative data collected from this study do point to some potential reasons for decreased level of satisfaction with case managers, such as the lack of being able to invest more time into each client individually. Respondents were also overwhelmingly satisfied with their HIV providers. 65.2% of clients were very satisfied with the care, 26.1% were satisfied, and only 8.7% were neutral. This indicates that the vast majority of Ryan White program clients are satisfied with the care that they are receiving from their providers. However, more research should be conducted to determine their level of satisfaction with the way their care is coordinated rather than with their specific HIV provider. These quantitative results demonstrate the following two unmet needs of the Ryan White program clients in northern Arizona: education about disease transmission prevention and access to sexually transmitted disease protection. Providing Ryan White program clients these two needs may help to decrease transmission of the disease. HIV spread can hopefully be contained or eliminated by teaching Ryan White program clients and other members of the community about HIV. In their appraisal of the Ryan White program, clients felt that overall the program met not only immediate material needs such as food boxes, medication assistance, and utility assistance, but also intangible social needs via group meetings and case manager support. However, clients also reported a general lack of awareness regarding programmatic offerings and policy. Moreover, they expressed a desire to become aware of such, while Ryan White program staff assumed that this was not interesting to them. As was discussed in the focus groups, this disconnect may be met with short introductory presentations at the beginning of their group meetings, which would arguably empower clients to not only be in a better position to advocate for themselves, but also in behalf of other clients living in northern Arizona. However, to demand more time from an already overtaxed case management team would be difficult to prescribe without an increase in funding from the state to employ additional case managers. Family was a prominent theme in the narratives of clients and providers alike. In fact, various clients explained a secondary occupation of novel familial roles, which perhaps can be explained by the stigma-induced relinquishment of former social positions following public revelation of their disease status, as many reported a negative family impact on their ability to cope with the infection. Additionally, many reported that suicidality and mental health deterioration may have been subverted by the notion of being relevant in the lives of their family, whether it was a pet, a child, or partner. Family provided to be protective against poor mental health. This research was conducted in a relatively unique geographic distribution. Results from this study would be difficult to apply at other Ryan White program sites, particularly in more urban locations.
The Ryan White program and North Country Healthcare are frequently tackling the challenging task of evolving and adapting their services to meet the ever-changing needs of the HIV population in northern Arizona. This assessment has discovered areas within the Northern Arizona Ryan White program that have the potential to be altered for the improvement of its clients' well-being. These areas include improvements in the accessibility and affordability of transportation, financial and/or medication assistance, disease prevention education, and more reflexivity between the state in order to understand the limitations of the Ryan White program in northern Arizona. More research is needed to identify several factors uncovered during the assessment, including the explanation behind the large percentage of survey respondents that exhibited high-risk behavior. For example, finding out why HIV-positive patients are knowingly having unprotected sex and sharing needles will help the Ryan White program better serve its clients and protect the community from the spread of HIV. More research is also needed to identify ways that a stronger connection can be made between the Northern Arizona Ryan White program and the state. This could help the Ryan White program care better for its patients and decrease disease transmission. As the Ryan White program plans and allocates funds for future changes, this study offers the following recommendations. As clients have proven that group sessions are of great importance for support, it is recommended that adequate funding be allowed for this to continue. It is our recommendation that RWP clients, particularly new clients, work closely with case managers in coordinating care, such as priming clients with potential questions for HIV providers, as difficulty was expressed in formulating adequate questions at the beginning of their disease progression. This would assure needs and appropriate questions are addressed in the appointment and limit the confusion isolation, and disorientation that were expressed in our focus groups. This increase in support during the beginning of the client's disease progression may also be helped by the establishment of peer mentoring support program and could provide care coordination support, protection from feelings of isolation, and an overall increase in self-worth. Finally, due to the unique geographic area covered by the Ryan White program of Northern Arizona and the feeling that case managers are already overstrained, it is recommended that additional funding be provided to hire supplementary case managers that may offset the burden of managing clients in such an expansive and rural Northern Arizona.